The human body's inner workings can be both awe-inspiring and intricate, a labyrinth of delicate systems and functions. Yet within this intricacy lies vulnerability, where certain silent threats can lurk unnoticed. Today, we're venturing into the realm of esophageal cancer, a condition that often tiptoes in silence, but demands our attention. Your body's gateway for sustenance and nourishment, the esophagus, navigates food from mouth to stomach with seamless ease. But what happens when this pathway becomes a battleground where silent foes lay their siege? Esophageal cancer, though relatively rare compared to some other cancers, manifests itself through subtle yet unmistakable signs, signals that, if ignored, can alter life irreversibly. From the seemingly mundane discomforts to the whispers of warning etched within persistent symptoms, these signs echo the body's plea for attention. Esophageal cancer is a testament to the complexity of the human body and the challenges it might encounter. Yet, armed with knowledge and awareness, we empower ourselves to recognize, address, and potentially thwart this silent intruder. Hey guys, welcome back to our channel. In today's video, we will be looking into 7 causes and warning signs of esophageal cancer you must not ignore. Let's delve into the warning signs of esophageal cancer. 1. Difficulty swallowing, dysphagia. Esophageal cancer often reveals its presence through subtle yet concerning signs, and difficulty swallowing, medically termed dysphagia, is a prominent one. At first, it might seem innocuous, an occasional feeling of food, sticking, or difficulty passing through the throat or chest. This discomfort usually surfaces when attempting to swallow solids or liquids. However, as the disease advances, dysphagia intensifies, becoming more than an occasional inconvenience. It transforms into a persistent and distressing issue. Swallowing becomes notably challenging, making it increasingly uncomfortable or even painful to consume food or fluids. This difficulty swallowing isn't solely limited to solid foods. Liquids may also pose a challenge. The sensation might vary, feeling like food is getting stuck or encountering resistance while trying to swallow, leading to a sense of blockage. As the cancer affects the esophagus, the natural passage for food and liquids to reach the stomach, these impediments become more pronounced. Although dysphagia can stem from various health issues, it's crucial to take persistent or worsening swallowing difficulties seriously, especially if they persist for weeks or months. Consulting a healthcare professional for a thorough evaluation and timely diagnosis is pivotal, as it could aid in the early detection and treatment of potential esophageal cancer or other underlying conditions causing dysphagia. 2. Persistent heartburn or acid reflux. Persistent heartburn or acid reflux, beyond what might be alleviated by typical over-the-counter remedies, demands attention, especially when considering esophageal cancer risks. Chronic, recurrent acid reflux triggers a troubling chain of events within the esophagus. The repeated backflow of stomach acid into the esophagus due to a weakened or malfunctioning lower esophageal sphincter can lead to chronic irritation and inflammation. Over time, this ongoing irritation may cause damage to the esophageal lining, a condition known as Barrett's esophagus. This condition elevates the risk of developing esophageal adenocarcinoma, a form of esophageal cancer. The progression from acid reflux to esophageal cancer is not immediate but occurs through a process of cellular changes. The continuous exposure to stomach acid irritates the cells lining the lower esophagus, prompting a transformation in the cell structure. Over time, these changes may culminate in the development of cancerous cells. While occasional heartburn is common and often benign, persistent, unrelenting heartburn that doesn't respond to usual treatments could signify an underlying concern. If this symptom persists or intensifies, seeking medical attention for a comprehensive evaluation and appropriate diagnosis is crucial. It's particularly important for individuals experiencing chronic heartburn to discuss their symptoms with a healthcare professional to rule out potential risks like esophageal cancer. Early detection significantly enhances treatment options and prognosis. 3. Unexplained weight loss. Unintended weight loss, especially if it's substantial and not attributed to changes in lifestyle, diet, or physical activity, can be a red flag for several underlying health conditions, including esophageal cancer. Esophageal cancer, as it advances, can disrupt normal eating patterns and impact a person's ability to consume food comfortably. Difficulties in swallowing or persistent pain while swallowing, dysphagia, can discourage eating, leading to a decreased appetite. Consequently, this reduction in food intake, combined with the body's increased energy demands due to the cancer, can result in unintended weight loss. However, it's important to note that weight loss alone is not solely indicative of esophageal cancer. Many conditions can cause weight fluctuations, and various factors contribute to unintended weight loss. Nevertheless, when accompanied by other concerning symptoms like difficulty swallowing, persistent heartburn, or a history of acid reflux, unexplained weight loss becomes more significant and warrants prompt medical evaluation to explore potential underlying causes, including esophageal cancer. Any unexplained weight loss should prompt a conversation with a healthcare professional for a thorough examination and proper diagnosis. Early detection and intervention offer the best chances for effective treatment and improved outcomes. 4. Chest pain or pressure. Chest pain or pressure that persists or intensifies should always be taken seriously and investigated further, particularly if it's chronic or unresponsive to typical remedies like antacids or changes in position. Esophageal cancer, especially when it has advanced or spread, can cause discomfort or pain behind the breastbone. This sensation might be mistaken for heart-related issues like angina or heartburn due to its location and nature. However, it's crucial to differentiate between these conditions as the cause of chest discomfort. Persistent chest pain unrelated to heart issues or reflux, especially if it continues or increases over time, requires evaluation by a healthcare professional. Such discomfort might be a symptom of esophageal cancer or other conditions affecting the esophagus. If someone experiences prolonged or worsening chest pain, particularly when accompanied by other concerning symptoms like difficulty swallowing, unintended weight loss, or persistent heartburn, seeking medical attention promptly is crucial. These signs warrant a thorough examination and diagnostic tests to rule out potential underlying health issues, including esophageal cancer. Early detection and intervention significantly impact the prognosis and effectiveness of treatment. 5. Chronic cough or hoarseness. A persistent cough or hoarseness that doesn't resolve despite adequate treatment or time may be an indication of esophageal cancer. The tumor's proximity to the respiratory tract can cause irritation, leading to a chronic cough or changes in voice quality. 6. Regurgitation of food. Frequent regurgitation or bringing back undigested food, especially shortly after eating, is another concerning symptom. This regurgitation might be accompanied by a bitter taste or a foul odor, signaling potential obstruction or narrowing of the esophagus due to cancerous growth. 7. Fatigue and weakness. Esophageal cancer can cause generalized symptoms like fatigue, weakness, or a sense of overall malaise. These nonspecific symptoms can occur due to the body's response to the cancer, including metabolic changes or the impact of the disease on overall health. It's crucial to remember that while these signs and symptoms might be associated with esophageal cancer, they can also be caused by various other conditions. However, their persistent presence or worsening over time warrants prompt medical attention and evaluation by a healthcare professional. Early detection significantly improves treatment outcomes and prognosis, making it essential not to ignore these warning signs. Now let's discuss 7 causes associated with esophageal cancer. 1. Chronic gastroesophageal reflux disease, GERD. Persistent acid reflux and chronic inflammation of the esophagus due to GERD can lead to Barrett's esophagus, a condition where the normal esophageal lining is replaced by tissue similar to that of the intestine. This condition increases the risk of developing esophageal adenocarcinoma, a type of esophageal cancer. 2. Tobacco and alcohol use. Heavy and prolonged use of tobacco, particularly smoking, significantly elevates the risk of developing esophageal cancer. Similarly, excessive and long-term alcohol consumption also increases the risk. The combination of smoking and alcohol consumption significantly magnifies the risk. 3. Obesity and poor diet. Being overweight or obese, especially when coupled with a diet low in fruits and vegetables, can contribute to an increased risk of esophageal cancer. A diet lacking in essential nutrients may not provide the necessary antioxidants and protective elements to combat cancer development. 4. Nutritional deficiencies and poor eating habits. Chronic malnutrition or deficiencies in vitamins and minerals, especially vitamin C, vitamin E, and selenium, are linked to an increased susceptibility to esophageal cancer. Poor eating habits, including a lack of fresh fruits and vegetables, may contribute to this risk. 5. Barrett's esophagus. As mentioned earlier, Barrett's esophagus, a condition where the lining of the esophagus changes, raises the risk of esophageal adenocarcinoma. Individuals with this condition have a higher likelihood of developing cancer in the esophagus. 6. Achalasia. Achalasia is a rare disorder affecting the esophagus, causing difficulty in swallowing due to the inability of the lower esophageal sphincter to relax. People with achalasia have an increased risk of developing squamous cell carcinoma of the esophagus. 7. Environmental and occupational exposures. Exposure to certain environmental and occupational hazards, such as inhaling airborne irritants or coming into contact with industrial chemicals, might contribute to an elevated risk of esophageal cancer. Factors like exposure to asbestos, certain metals, or chemical fumes may increase the likelihood of developing the disease. Understanding these risk factors can help individuals take proactive measures to reduce their risk of developing esophageal cancer, such as adopting a healthier lifestyle, avoiding smoking and excessive alcohol consumption, and seeking medical advice for conditions like GERD or achalasia. Regular health checkups and screenings are also essential for early detection and timely intervention.